Good morning. This week we released a revised order for assisted living facilities and nursing homes and residential care facilities. For the first time, these types of facilities will have different regulations and requirements by our public health orders. We are relaxing visitor restrictions in residential facilities that do not offer assisted living or nursing care. These facilities that do not offer assisted living or nursing care can have visitors inside of their buildings if they follow strict social distancing guidelines. These visitors in these types of facilities will be screened as employees of these facilities are screened with temperature checks and other questions. Examples of buildings that can have visitors inside of their buildings are independent living facilities and senior apartment complexes. Assisted living facilities and nursing care facilities still cannot have visitors inside their buildings except for end-of-life circumstances. However, under this new order, assisted living facilities and nursing care facilities can have visitors on their property outside of their building, again following social distancing guidelines. If a residential living facility has many different levels of care, then they will be required to follow the more restrictive level of care for their common areas, where individuals living independently may be mixing with individuals who are in assisted living or nursing care. So the more restricting requirements will be required in the common areas. Facilities that do not share common areas for those living independently and those in assisted care or nursing care can follow the guidelines in those common areas based on those who are present in those common areas. The social isolation of seniors is a concern, and we're going to continue to look for creative ways to allow family members to visit with individuals in senior living facilities that do not risk their health. The data tells us that residents in these types of facilities are the most vulnerable. Up to 25% of our COVID-19 infections are from residents in these senior living facilities, and even a higher rate of loss of life is present from residents who are infected in these types of facilities. So we are taking these steps developed with our public health department and in conjunction with nursing homes to make sure that we keep our seniors safe as possible. We will continue to monitor cases, and we'll continue to monitor transmissions, and we will consider updating these guidelines in the future. This week we also began to offer expanded COVID-19 testing in our public health facilities in St. Louis County. This includes the John C. Murphy Center in Berkeley and the South County Center in Sunset Hills. We are offering expanded testing to asymptomatic people in St. Louis County who are in frequent, regular contact with others outside of the home and would like to be tested. Since announcing the expanded testing last week, we've had over 6,000 phone calls to our public health department. We have been able to schedule or test 700 of those individuals so far. We will continue to prioritize for testing individuals who are symptomatic and individuals who have been exposed to someone who is known to have COVID-19. To get scheduled more efficiently, today we are offering online scheduling at stlcorona.com. You can click on COVID-19 testing. Tests are available at the St. Louis County Public Health Department from 8 a.m. to 5 p.m. with an appointment. Interest in getting a test remains high in St. Louis County, and we will continue to coordinate testing and help provide testing information for the many other facilities in the county in addition to St. Louis County Public Health who are providing testing services. As more testing sites continue to open in the county, we will work with everyone to make sure that they have access to a test. The more people we get tested, the more we will be able to understand the reach of COVID-19 in our community. I'd be glad to answer any questions.
Dr. Chris, you had put out a tweet yesterday about looking at roads, statues,
Yes.
and the like, in the wake of the Christopher Columbus statue coming down. Could you elaborate just what your thought process is there? Do you think that there are going to be things coming down in the county? Are there statues and the like that you're concerned about? What's your
Well, I
thought
think we
process?
have to address this in a thoughtful and organized way. I don't think we should be looking at these one at a time when someone brings it to our attention. I think we need a thorough and comprehensive review of roads and parks, and it needs to be done by individuals who have expertise in this area. That's why I asked Hazel Irby, who is our Director of Diversity, Equity, and Inclusion, to work with our Parks Director, Tom Ott, and our Director of Transportation and Public Works to review road names and park names and make sure that we just look at everything in the county instead of one or two roads at a time as they're brought to our attention in the community. We'll take these seriously. We are in a new point in our history where we have to review this in a very thorough and thoughtful way, and that's what I'd like to do.
Are there ones that concern you? Are there anything that stands out in your mind at this point?
Well, yesterday we had heard some concerns about Dorset Road, and that was the one that was brought up in the media. But it really is obvious to us that there could very well be other street names in our community, and rather than going through them one at a time, I think we should have a process, and we should have a process to just have a thoughtful review. And then it also gives us an opportunity to have a community input and community conversation about this, and that's what I'd like to do.
I'll ask about a couple COVID things. Actually, really just one. Obviously, this latest layers of businesses opening within the last couple of days. Have you heard from business owners any good, any bad that's been coming out of, especially gyms, I guess? Have you been talking with business owners, and what is
Yeah, the feedback universally is a good conversation. We provided some pretty thorough guidelines that we built in conjunction with civic leaders, business leaders in our community, with the City of St. Louis, the Economic Development Partnership and their resources. And we spent a lot of time working together with a lot of individuals to develop guidelines that were very thoughtful. The feedback from our business community is they're very grateful for those guidelines. They find them very helpful. On occasion, they have questions that are specific to their type of business or their individual business, and we do our best to answer those. We did get a lot of questions early on, and we answered those as quickly as we could. But the feedback from our business community is a lot of gratitude for those guidelines and for the cooperation they received from St. Louis County. What I see in the community is pretty widespread acceptance of those guidelines, and I see a lot of people in the community practicing social distancing. I see a lot of people with masks on, and that really is our path forward. On occasion, I see people without masks, and I would like to see the mask compliance higher in our community. But as it stands now, it's pretty good, and that is what will keep us safe, and that's what will keep the transmission low. Our businesses following the guidelines, and what I hear from them is really an eagerness to know what the right thing to do is, so they can just do it. And I see a lot of people in the community following those guidelines too.
It may be a little premature to ask this, but does it seem like we're still on track of loosening some of the capacity restrictions at the end of the month?
I think so.
Okay.
And we'll continue to watch the testing results. We'll continue to watch that hospital admission number from the Pandemic Task Force. Members of our community can follow along at stlcorona.com. We have a dashboard that monitors the number of tests in the county every day, the positive rate of those tests, and we'll continue to follow all of these numbers, and we'll continue to watch the acceptance of social distancing guidelines in our community.
On the nursing home question, what's important about loosening those restrictions, and how concerned are you about what could happen in terms of more cases with people being able to interact more?
Well, first and foremost, we have to keep our seniors safe, but we have to recognize that the risk is different based on the type of facility. We also need to recognize that social interaction with family members is very important, and it's very important to their quality of life. So we have to find a safe way to allow our seniors in these residential care facilities to interact with their family members. And we've worked very closely with public health professionals, with medical experts, and with nursing homes to develop guidelines that we think strikes that balance to keep our seniors safe and to allow them the ability to interact with their family in a safe way. Any questions? Doug?
You have a couple from public radio. The reporter says, I went out over the weekend and saw many people gathering without masks in crowded spaces. Are you worried that lifting restrictions for businesses has created a sense that the COVID pandemic is over? Is there any way to get people to take social distancing seriously if they've decided they're safe now?
Okay, so the question from public radio is, to paraphrase, are we concerned that lifting restrictions gives the impression that this pandemic is over? And we will continue to talk about this and continue to message this, that this virus is still very much in our community. And if we don't recognize that, we can look across the country and see what's happening in other states where they loosened restrictions more quickly than we did, or had less restrictions to start with. We believe our restrictions were initiated early, that they were the right thing to do, that they saved lives, and they put us in a very good position to loosen them in a thoughtful and responsible way, and that's what we've done. We are in a much better position today than other parts of the country, and if we maintain social distancing, if we respect our social distancing guidelines, if we respect our public health orders, then we're on track to relax our capacity restrictions by the end of the month, and we'll continue to track our data. We'll continue to listen to our public health experts, our medical experts, the pandemic task force data, and we think we're moving in the right direction, and we're in a good spot right now in St. Louis County.
And you basically answered the follow-up question there, comparing it with other states and the concerns.
Yeah, I think if we look around the country and around the world, people are having a different experience than we have had here in St. Louis County. We initiated pretty tight restrictions early on, and we're in a better spot, we're in a better trajectory, but it does very much depend on people in St. Louis County following our social distancing guidelines, keeping your mask on. I understand it's frustrating, but that is why we are in a better place than the rest of the country, and that is what will keep us in a better place than the rest of the country if we continue to follow these social distancing guidelines. And I've seen really wide and thoughtful and responsible acceptance of our business guidelines, and I believe it's safe to move about our county, but let's follow these restrictions and let's keep us in the spot we're in right now. We need to remain vigilant.
So when you say capacity relaxing, you mean going from 25 to 50%?
Right.
Okay.
We'll do that by the end of June, and we'll see where we are. But we're in a good spot. It really, relaxing those capacity restrictions further absolutely depends on continued acceptance of social distancing guidelines by our community. And right now we see pretty wide acceptance. We just need to stay there and not relax and be vigilant.
And there is no timeline to go back to 100% capacity?
Yeah, I think we'll always have social distancing guidelines that will be different than before, and we will always see our businesses respect those social distancing guidelines. It will be hard to stay 6 feet apart and get to our original capacity, which was much more crowded. Mm-hmm. But let's get to 50% and